Hello, everybody. My name is Fotis Gulekas. I'm the work package leader for technology validation pilots and privacy assessment. Our colleagues before presented in detail how SPHINX tool works in a hospital environment. Of course, we used replicated environments in these three pilots. My presentation has to do with what we gain as end users and what were the lessons learned from this activity. And starting from the first days of the project, all the whole design and the participation of end users into this project was based first on what we say as and define as a cybersecurity management cycle. And of course, we focused on the design based on the classification of the assets. In a nutshell, the first target was to identify the assets that we would like to protect. To this end, we classified the assets into 4 categories. First, we have the hardware infrastructure, which comprises several physical systems like data centers, switches, hubs, routers, etc. Then it's the networking equipment, the internet connectivity, the applications. Apart from the information systems, we have also other software that is crucial to enable mobile and wireless infrastructure. And of course, our main duty is to support our PCs and laptops with updated operating systems. And of course, the mainframe infrastructure, which contains cluster services, routers, etc. Then, what we did in this project is to, based on the SPHINX Toolkit, to try to develop some security policies and guidelines, and also to assign through this activity to understand better the way that we need to assign security responsibilities to technical and administrative personnel. Then the aim was to, by using the SPHINX technology, to detect early enough and all reactively, but also to perform proactive actions in order to identify possible cybersecurity incidents, and of course, then to define a plan on how to respond to a specific attack and how to recover. So based on these principles, we followed the design methodology where the requirements were defined based on the Polaris specification. It's a standard that we used in order everybody to understand what we discuss and what we mention. So it was easy for us as end users to consolidate our requirements with the technical knowledge of the partners that developed the SPHINX Toolkit. And through this, we managed to achieve the co-development. After that, we proceed with the use cases. The target here was to match the requirements to specific cybersecurity use cases, and this was based on previous attacks that we had in our infrastructure and what we faced through our ICT experience, not only in hospitals, but what we see in various circumstances. Then, based on these requirements and these use cases, as end users, what we asked from the technical partners to support the SPHINX Toolkit was first interoperability, in terms that we would like to have the SPHINX Toolkit to interact and be integrated with tools like firewalls, domain controllers. It was something that guys saw before in pilot's execution presentation. To have open interfaces, of course, and the last but not least is the easy development, which means that we would like from the SPHINX Toolkit to be easily deployed and easily configured. So the learning curve for exploiting the capabilities of this tool and deploy it to our daily activities be really short. Finally, we define specific KPIs with the help of and the assistance of the technical partners, which are very experienced in this field. And the lesson here that we get, that we learned, is that it's important to define the specific key performance indicators so as to address the performance of the cybersecurity strategy that we follow in our hospitals. In this slide, I give you an example of how we managed to capture and define the requirements following the Polaris methodology. First of all, we had the requirement ID and the requirement type. There are two types of requirements. The first one is the functional requirement, which means that it's a fundamental requirement that shows how the product operates. For example, a functional requirement that we can see is that the SPHINX Toolkit should provide an automated certification service, which means that the SPHINX scans a device and gives a certification that is safe to be incorporated to hospitals' network infrastructure. The non-functional requirement shows a specific characteristics of the tool that under development that needs to support. For example, the requirement here is that the SPHINX should be easily upgraded and maintained. So this is a requirement that is not functional, but it's necessary as end users to have it as end users to have it on board, which means that we can easily upgrade and maintain the SPHINX Toolkit. Here we show how we managed to define a use case. We have a use case, specifically a ransomware attack to a healthcare data. We define the scope, what is the application scenario, what is the attack type, who involved in this attack, what were the attack vectors, and of course, what the threat actors were. What the vulnerability exploitation target? This means that by having this attack, what was the specific infrastructure that was out of service? In this example, for example, we had some problems with SMB protocol apart from the encryption of the data itself. This is and what was the effect of this attack? We defined the affected assets, and we defined also the criticality of the affected assets. So based on this, we brought SPHINX role, and we defined how SPHINX Toolkit should operate in each one of the attack phases. We had the initial conditions when we get the attack, the pre-attack phase, the attack phase, and the recovery phase. And based on this use case definition, we managed as end users to understand more things regarding how an attack is initiated and how a cybersecurity tool should operate. And we had the luck to participate in proper definition and what we would like to have from this SPHINX Toolkit. For example, as guys presented before, we have the vulnerability assessment tool that can be used during the initial conditions. And during the attack phase, there are several tools that can be used in order to identify the possibility of the malware propagation and identify the source devices that were affected. And of course, during the recovery phase, SPHINX reports can help us to elaborate more on the attacked data and, of course, to perform the proper forensic action. Now, through this project, we have defined these key performance indicators. one of these key performance indicators help us to measure the performance of the SPHINX toolkit. To be frankly, during their activities, several of them are employed, but through the participation of the SPHINX project, we identified more key performance indicators, which from now and on are have been employed and used in our daily and daily action. So the key performance indicator is the time to detect the vulnerabilities, false positives. I mean, we have an alert. Is it a false alert or it's an alert that we should take into account? The time, a very important metric is to measure the time to resolve the vulnerabilities. Also, it is an important thing is that that we managed to measure is before having SPHINX up and running, we had some devices on the network that were identified. For example, some doctors brought their laptops without having informed, without ICT department have been informed. So based on this, based on the tools that we used in SPHINX environment, we managed to identify the devices that previously were not identified. Another important key performance indicator is the ratio of alerts triggered to alerts remediated. How many alerts we managed to deal with. The redundant events is also something very crucial to have it as a statistic. And of course, what we need every day is to have a number about the open incidents related to critical assets. So all of these KPIs have been utilized in our cybersecurity management cycle, and based on SPHINX tool and our collaboration with the technical partners helped us to understand better these KPIs and how we can measure them. Now, during the project, an important thing that we managed to perform is that to build the security culture among the healthcare employees. Within this context, we have performed a cybersecurity awareness campaign. First, we perform some workshops with targeted sessions and audience. We distributed some targeted questionnaires, analyzed the results, and designed the next work. So it was an iterative process. During the first period that we executed this cybersecurity awareness campaign, we determined the participants of the Healthcare ICT employees and the rest of the healthcare employees. So we had two participants, two major categories of healthcare employees, the ICT employees and the rest of the healthcare employees, nurses, doctors, biomedical staff, and technicians. We distributed a questionnaire, and we collected and interpreted data. So this the first cybersecurity awareness survey was executed September, November of 2019. Then we assessed the results that we received from the questionnaire, and we started building the next stage of awareness campaign. So what we did first to initiate an internal awareness campaign, we distributed in 3 languages, Greek, Portuguese, and Romania, some leaflets to hospital departments where we gave some basic hints and guidelines and what to proactively secure their activities. Then we also performed a cybersecurity awareness webinar for IT workforce. And finally, we performed a post-evaluation phishing simulation campaign based through the collaboration of another European project, where we used a security building culture tool. The results of indicative results of the survey responses shows that the percentage of the correct answers. For example, we asked from the IT personnel to answer to specific questions. For example, do you ensure that password regularly change on the network devices, and we collected the answers. What is the concept of reducing the attack surface? We collect the answers, and we saw that 73% of the ICT employees in hospitals managed to answer correct to this question. Now, regarding the phishing quiz score, we have created some emails, legit and fraud emails, and we distribute these emails to them. Specific email accounts through the hospital organization, and we measure the performance of the users to deal with this email. So we had a very good success rate after having initiated all this cybersecurity awareness campaign. Finally, the technical partners helped us also to be trained before using the SPHINX Toolkit, and specifically we used the Facebook's capture the flag tool, and we used the hospital application environment DP5, where we were on the side of the IT team, and technical partners initiated some a quiz where several tasks have been initiated and performed in this replication environment, and we were asked to answer to each one question by using a specific tool from the SPHINX ecosystem. Here we show an example. For example, the target here was to detect a port scanning. So the main story was here that a malicious user tried to investigate what the other assets inside the network, more specifically which servers were up and running. And the target here was to find out the signature of this alert. So we used the data traffic monitoring dashboard, and we managed through this to go to the signatures in the dashboard, and we isolated the specific traffic, and we managed to identify that the signature, where we find out that the malicious user performed a Nmap port scan. So finally, what I want to say is that if we would like as users to perform to incorporate a cybersecurity governance model in our organizations, first of all is to understand the regulations. We have to be compliant to the regulations. We have the GDPR, we have the NIS directive, the EU legislation, we have the NISA strategies, we have some equipments regarding the ICT equipment, and of course, national legislation frameworks and national laws regarding cybersecurity and data protection. On the other hand, there are a plethora of tools that we use during our working day, and we execute, evaluate several actions like incident reporting, identify the threat register, monitor the traffic, try to find the anomalies, and through these activities, we try to protect the organization in terms of infrastructure, network, and people, the patient data, and the medical devices. So we have three pillars that are necessary to be supported by our cybersecurity governance model. These are the regulations, the way that we apply and reuse the regulations, through the combination of the execute through the tools that we incorporate in our ICT infrastructure, cybersecurity tools. And what I would like to say is here is that SPHINX comes to bring a solution to by supporting all of these activities in the third pillar through automated cybersecurity certification, risk assessment, incident reporting, and this help us to involve our cybersecurity governance model and also to be compliant with various regulations. In a nutshell, through the involvement and participation of this in the SPHINX development tools and how we execute it, how we build the replication environments, and how we manage to deploy, how we manage to execute the tools in these environments. I would like to say that from end user perspective, we're wiser now. We understood better how attacks are initiated, and we managed to understand better how our assets work. And we first of all, the gain was that we have a tool that we can use in this early stage of the development to help us to improve our cybersecurity strategy and actions that we take every day. We managed to have access to new cybersecurity technologies. And of course, we have built a cybersecurity awareness campaign that is now in our under our initiatives, which means that iteratively as an ICT department, we are conducting awareness campaigns in a regular time so as to help the rest of the healthcare employees to learn their way and how they should be protected during their daily activities from various attacks. And of course, we also built the path on how the rest of employees could communicate with us efficiently and be supported. And of course, as IT, healthcare IT staff, we have initiated an iterative process to assess risk and threats by using this SPHINX ecosystem. So this is my presentation. In the figure, we can see that although we can have 24 per 7-day security monitoring, still a user can open an email attachment. So what we need, what's necessary here is to continuously perform cybersecurity awareness campaigns and educate the user to behave accordingly when an email with, let's say, malicious attachment is received. So, thank you very much.